Ministry of Health, initial response was focused on the virus itself. So we were, buying PPE kits, N95 masks, headgears, and gloves, and using hand sanitizers, checking temperatures, flu symptoms, etc. But we were not looking at the long term negative consequences of COVID 19 on people's mental health. How would we take it? Like, with social isolation, not seeing our loved ones, being confined to the four walls of their rooms, and not going to meet your friends, to socialize with them, or not going to your workplace and meeting your workmates there. So it has caused more distress and suffering than the virus would have caused in itself. So if you look at some research which is done world over, we have astounding figures. The major worry which started as soon as COVID hit several countries world over was many countries shut down or they reduced the number of their employees. Like we have food lovers, they shut down several outlets. So there were several hundred employees which were now unemployed. So when we look at the surveys done, one in five, or 20%, um, of the people were concerned about losing their jobs. Okay, and again another one fifth uh, who were identified as unemployed. They had suicidal thoughts. Now, what's going to happen to the kids? Who will pay school fees? How will they put food on the table? What will happen to their livelihood? They may have had made so many plans of buying a car, building a house. They may have been taking loans to do certain activities because they were regularly employed. And all of a sudden, that employment is gone. So it brought out suicidal thoughts in many of those who were unemployed. There were financial concerns, mostly was with people in the middle age. Because that's when we are all thinking about, okay, I've done enough. Now I should plan to settle down and plan my retirement in the future. And then COVID hit. Before we could settle down and plan our retirement, we find that we are again equally worried about how to make ends meet, how to carry on with winning our daily bread. Twice as many people unemployed surveyed say that they are not coping well with the stress of the pandemic compared to people in employment. So you see that those who were employed, their stress levels were still fine, but those who were unemployed, their stress levels were double that, and they could not cope with being unemployed during COVID times. Over 1 in 10 unemployed people surveyed say nothing has helped them cope with the stress of pandemic. Okay. Nothing has helped, not counseling, you know, not uh, asking help from the family, from friends, and other areas where they could have found help. So they find that it hasn't helped them, and they still the sense of unemployment is still looming large over their heads. So obviously, with that will come worries about finances, about debts that they may have incurred, and having enough. Whereas the overall picture for many has been improving as we have learned to live with COVID. Still, one third, about 33% of the people, still worry about their finances, like paying bills and also paying back their debts. People in lower socioeconomic status, which is about more than one third, are more likely to have financial concerns than people who are in higher socioeconomic status. And almost half of those who were unemployed worried about having enough food to meet their basic needs in the past 2 weeks as compared to those who are in unemployment. So you can see that after having done so much, being in employment, and there comes a time when we are again worried about making our ends meet or making our basic needs getting fulfilled. So COVID 19 had both short term and medium to long term effects. It also had direct and indirect effects. So when we look at um, short-term effects, it was threat from COVID-19, which was perceived and actual. So threat from COVID-19, perceived like, yeah, you got exposed to someone who had COVID positive, or yourself got COVID positive, then what it would lead to is anxiety or exacerbation of existing symptoms, which are psychotic symptoms. So they will become more severe than they were before. If there was a bereavement in the family, then we found that depression was something that would be a probable outcome. During lockdown and isolation, we find anxiety was skyrocketing. There were a lot many cases of depression. Okay. Again, there was increase in the existing psychotic symptoms of patients who were already suffering from mental health problems. There was a remarkable increase in alcohol misuse and other addictions, mainly because people were trying to self-medicate themselves to reduce the anxiety and stress caused by this traumatic situation. So at one point of time, we found that um, one of the leading hospitals in the country had around 25 admissions with patients suffering from severe acute alcohol withdrawal. The reason being, during lockdown, all the bars and places where alcohol was sold were closed down, and these people who were not prepared to stock up their alcohol did not have enough on them and therefore went into severe withdrawal states, which some of them presented with alcohol withdrawal, seizures or fits. Others became utterly confused, and others had life-threatening alcohol withdrawal delirium. So it was a very critical situation when the hospitals were not prepared to cater to substance misuse disorders whilst they were preparing to combat COVID related cases, which were increasing every day. Lockdown and isolation also had educational impact because we were not used to having virtual lectures. It was so convenient to see your lecturer present in front of you. There was a to and fro communication. Uh, the teacher could see if the student is following or would need some help, and therefore he would approach and help the people out. But now virtual, we are lying in our bedrooms and then having phone in our hand while the lecturer is teaching from their homes or from school premises. So to follow virtual lectures was sometimes very difficult, rather than having in-person lectures. And many students could not do well at all because they found it very difficult uh, to follow things on the phone or on their laptops as compared to when they were having in-person lectures. So you found that many universities and educational boards allowed students to pass because giving them a benefit of doubt because it was for the first time they were exposed to virtual learning. So definitely, it would have serious impact on their future careers. Some of them were finishing their degrees and were about to graduate and then look for jobs and occupation. And all of a sudden, you found that there are no jobs, and many of them they could not finish their exams because we were not used to having virtual exams. So we had to look at various medias. IT sector had to be strengthened so that we could prepare virtual examinations which are foolproof and which actually test the students' aptitude, and they are not like opening books or making use of media to respond to the questions. So education really had a huge impact because of the lockdown and isolation. It also had a potential economic impact. We all know that when COVID started, kwacha to dollar was 14, and today it's 22.65. There's a massive decline in the last year and a half. And all this has caused a lot of uncertainty. Businessmen are not able to price uh, their merchandise because they don't know what will be um, quarter to dollar conversion tomorrow, and therefore they don't want to suffer any losses. And on the other hand, the buyers are not able to afford many commodities because the prices have doubled or tripled in some cases. It also affected personal relationships. People are not used to seeing their family, especially spouse, so long. They may have interactions later in the evening when both would come back from their work situations, and a couple of hours of interaction every day would keep their relationships healthy. It would give them their privacy, and also give them time away from home and family, which now because of lockdown was not possible. And therefore, uh, they were impinging into each other's personal space, and which led to a lot of domestic violence because of resilience or resistance or rebuking from either partner, which led to anxiety, depression, and also post-traumatic stress disorder. There were many cases of gender-based violence which reported to us secondary to lockdown. Talking about medium to long term effects, all those who were admitted after having COVID had gone to ICU. Believe you me, it's not a very pleasant experience when all those machines and gadgets all around you making different kinds of sounds, and you are facing death. It is really staring at your face. So those who went through, they present with anxiety disorders, for example, panic attacks. Any sneezing, any cough, or difficulty in breathing, and they would think that maybe another episode is about to happen. Many went into depression, severe depression for what they went through in the ICUs. And obviously, post traumatic stress disorder, they kept on being reminded of the traumatic situation that they were in. They would have nightmares about being in the ICU, being injected or given oxygen, failing to breathe, gasping for oxygen and breath. So highly traumatic experiences, or just seeing their next bed guy, patient, having succumbed to COVID or any other condition, and then thinking that is that what my future would be. So all that caused a lot of PTSD, post-traumatic stress disorder, amongst patients. Those who lost their loved ones, they had prolonged traumatic grief, which is complicated grief, and which is similar to being severely depressed. There was also huge psychological impact on the frontline staff, like healthcare workers, doctors, nurses, those health personnel working in casualty departments. So we had so many healthcare personnel reporting insomnias, reporting stress, anxiety, failing to cope with so huge work pressure, where many of them are saying we hardly sleep for 2 or 3 hours and we have next emergency, and we haven't managed one and another one lands up. So it was very difficult for them to cope with such huge stresses of facing patients who are presenting with near death complications. and obviously being understaffed didn't help. The actual impact, for example, being unemployed, job insecurity, or reduction in income, many of us had a cut by 20%, 30%. The debts were ever increasing. Housing loss, those who got unemployed also lost their houses, and also loss of socioeconomic status. Okay, so it had a long-term effect on these people, which eventually led to anxiety, depression, suicidal thoughts, suicidal threats, or suicidal attempts, and again, increase in alcohol misuse and other addictions as a way of self-medicating themselves. It adversely affected personal relationship, and again, that included domestic violence, which I spoke about in short term, also went into long term effects of COVID, and again, leading to similar complications as we discussed earlier. So there has been so many news which have been going around in social media, in the newspaper. Uh, you can see on WhatsApps, on Facebooks, Twitter, blogs, people writing, and each one of them have to tell us a different story. Uh, but it is very easy to get carried away by those stories, which may not have any evidence base. Therefore, we put them in the form of a pyramid where the ones which have very high risk of bias are put at the bottom of the pyramid, and where those which have least effect or the least chances of bias have been put on the top. So you see any editorials, any expert opinions, so that will include WhatsApp, other medias, Instagrams, Facebook, and other posts on other social media. They should not be given much importance, and therefore they should be taken with a pinch of salt. Any mechanistic studies which I don't have any uh, cross-sectional basis, and they were just done on a few patients, or just case reports or case studies with one or two or three clients, should not be given much importance. We cannot generalize what happened in one patient. Like there have been so many talks about taking steam, putting eucalyptus oil and inhaling that steam, or taking a lot of ginger or garlic or other herbal products, but they don't have any authentic basis. There's no evidence to support that. Yeah, there is evidence to support the steam, but all the ingredients that you add to it, there has to be a scientific basis to that. And there should be some laid guidelines on how much of what to add and how much of which herbal product to take. Unless it has been researched and supported by evidence, we should not fall into the trap of using such remedies. There have been some cross-sectional studies and surveys which have been done in various parts of the world. Yeah, some of them have brought out good results. For example, initially it was use of hydroxychloroquine, which was promoted world over. Similarly, use of antibiotic azithromycin, and it has been accepted world over. Later on, came in the use of steroids and now aspirin in managing conditions related to COVID complications. So they have certain strong bases on which we can say that yes, they're helpful and we can follow those. There were case control studies where they were following cases from the onset of COVID symptoms to when they got discharged or if they succumb to their complications. So they also helped us to learn the pros and cons, what is good and bad. Like for example, initially everyone was being put on a ventilator, and so many ventilators were being donated to several countries. For example, UK, where there was a huge impact of COVID initially. But later on, they found that there were more deaths of people who went on the ventilator. And just um, oxygen. was good enough to sustain the life of the patient rather than putting them on mechanical ventilation. So there are other studies called cohort studies where we look at a cohort where there were several patients with COVID and what medications helped them, what regime did they follow, what were the complications, doing the lab investigations like polymerase chain reactions or looking at the D dimer or blood counts, etc. So we have a complete picture of how does a COVID patient's lung look like, how much damage would mean if it is COVID, or how would the C-reactive protein values be, which are showing abnormality. Um, Similarly, the randomized control trials, which have highest authenticity, where they have been comparing groups with different medications or different regimes which they have followed and showing that how is one regime as compared to the other, how is one mode of treatment as compared to the others, and then they bring out the facts that what are the outcomes of these, and then those they are highly authentic and can be followed by others world over. So, meaning by we should pay least attention to media and most attention to a randomized controlled trial or cohort studies. Therefore, if you read something on Google, just check where is it coming from. Okay, is it a study or is it a survey? Is it a case report or is it just someone's expert opinion, which we may not add much value to? So COVID also had major impact on people who were already having pre-existing mental problems. So I can just state about the statistics at my clinic, where we found that um, there was around 62% of the people that were visiting my clinic had felt anxious or worried in the past 2 weeks due to the pandemic, and more largely it was after the second wave in India, where we found that so many people were getting infected and there were so many deaths to the extent that even the funeral places did not have um, enough space for them to bury the dead bodies or to carry out the funerals. So, groups affected by social-economic inequalities have been more related to experience anxieties. Those who are in the poor social-economic status, they become more anxious, they became more panicky, more hopeless, um, and there was also symptoms of loneliness. They were not able to cope well with the stress of the pandemic because they were already living under the low socioeconomic realm of society, and now this COVID had further worsened their situation. So COVID widened the mental health inequalities. So the groups that had poorest mental health pre-crisis were also having the largest situation in mental health during the lockdown. So again, this was mainly because people who were in low socioeconomic status were almost affording their medications and the treatment with a lot of difficulty. And now after COVID, a lot of supplies of medicines were restricted. A lot of donations from Western world did not come through. So we were running short of the medication. Essential drugs were not available. And those that were available, their prices were more than three times to what they were buying before COVID started. So definitely this widening of the mental health inequalities hit hard those who were already having poor mental health crisis before COVID. So there was additional stress and access to support and services because they were becoming more and more unaffordable by those in the low socioeconomic status. So, in conclusion, I would like to say that we go on with this situation, there will be generic worries about future across all populations in the world. We still do not know a lot about COVID. Yes, the vaccine has been floated. We still do not know how will it impact the population. and you can only be sure once 80% of the world population has been vaccinated. People are affected in different ways depending upon their age. Those with middle age and late age are affected more than those who are youngsters. Their demographic background. So definitely those in the Western world, they are having more facilities, more backup by the government, even by the private sector. So obviously they are better off than us over here. The employment sector, if they are in a secure job or not, type of job that they're doing, obviously health care workers, they are at a higher risk. And the contract, whether it be renewed or not, geographical area, membership of at-risk groups, again, talking about healthcare workers, those involved in vaccination, etc. Similarly, self-employed, as you see, there was so many times lockdown was imposed. Europe was in lockdown for 3 months. Canada is in lockdown for a month now. So several countries going to lockdown, meaning by self-employed people will have less chances of earning a living. And those with small businesses who live on very small amount of money would exhaust their reserves very fast. People with disabilities who need support, extra support from the hospitals or from healthcare professionals would have more impact of it. And also to some people from Black, Asian, and minority ethnic backgrounds, they would have major impact of COVID. Domestic abuse survivors and informal carers were also considered at very high risk in this context. So, what do we need to do? What necessary actions we can take? As we know, COVID-19 has challenged and changed the mental health services. Uh, Still, it has given us an opportunity to again sit down and look back at mental health care, how we can positively transform, because there's no health without mental health. How can we empower our clients with more knowledge, with more information, and tell them about their rights? Even in this time, they have all the rights so that no one abuses them. We can build on adaptability and flexibility of community-based care. Mental health should also go into the community rather than being based in tertiary hospitals like Chanama and UTH. So when community will come out and support mental health cause, then definitely we will have better chances of uplifting mental health in our community. There is a lot of importance of lived experiences, like people who went through COVID, what happened to them, what were the shortcomings, how did they find the hospital facilities, how could we have made it better? Okay, so what were the lacuna and how they can be bridged? So all that is a lived experience. So having known the lived experience of several people, we can design, develop, and monitor services in a better way. We should also involve public and private sector. We found that during early onset of COVID-19, many private organizations came forth and built makeshift hospitals, and hospital beds were provided extensively for COVID patients. So we do need such collaboration even in the long run. We should slowly start moving towards more virtual consults and also counseling people online, because in person may become more and more difficult and may impose more health risks on people than the virtual one. In our field, virtual consults, they are what we call as tele mental health, has been in reckoning since 1990s, and um, because in the field of mental health, you very rarely need any investigations, and most of the diagnosis is based on patient signs and symptoms. So therefore, it becomes much easier to diagnose a patient and plan their management, even virtually, rather than seeing them in person. We direly need a 24/7 psychological first aid helpline. It has been a serious setback. We don't have any psychological health services which can be provided in the time of the need for patients who are contemplating suicide or self-harm, going through intense anxieties and grieving the bereavement of their loved ones. So in such cases, if you can develop a psychological first aid, that would be immense help to people in Zambia. So we should enhance or accelerate the digitalization of healthcare. That helps in easy compilation of the data and comparison of the data across the country and across the world. So if we have digitalized healthcare services, then it's very easy to find out what kind of patients are seeking admission in the Copper Belt or in Lusaka province in the western province. So we are able to compare, okay, what kind of strain is more prevalent here? Why is it happening so? So whereas when we are maintaining the file system, it becomes so difficult to look into those data, bring out reliable information, and then share it. It may take a very long time before we will come out with any strong aspects from that data collection. So there's also a lot of importance of connecting physical and mental health. Uh, and therefore, each hospital should have a strong mental health unit because, again, as we say, there's no health without mental health. So once we accept and acknowledge that mental health is of paramount importance, then we will look into it with the same dignity as we look at physical health conditions. That's all from my side. Thank you so much for patient listening. I'm happy to have a few questions.
Dr. Ravi, thank you very much for taking us through.
Welcome.
Yeah, just to probably usher in the questions as probably the audience is thinking about them. Allow me to ask a few, probably connected ones, as we now allow the audience to quickly think through. If you have a question, you could raise your hand. I hope you can be able to find the icon to raise your hand or just indicate so that you can be unmuted, and then you can be able to ask the question. So Dr. Ravi, just generally speaking, if I am, what are some of the symptoms that would probably indicate that I am heading down the wrong direction psychologically within this context of COVID-19 especially? And secondly, if I'm able to identify those signs and symptoms, what should I do? Are there things I can be able to do personally prior to seeing the doctor? And at which point is it necessary to actually see a doctor? Probably you could begin with those as we wait for any other questions from the people that are on board.
So that's a very good question. As you have seen that most of us are aware of various signs and symptoms of COVID. And one of the most important symptoms is shortness of breath. Shortness of breath can occur from anxiety as well as from having COVID. So many patients, because they get anxious, they start having shortness of breath or start feeling breathless. And as the anxiety grows, it becomes very difficult for them to breathe and they go into what we call as a panic attack. Where they start feeling dizzy, their heart starts beating fast, they feel that they're gonna pass out or they may have a stroke now, they're gonna go crazy. So it all starts from a very uh, a vague sensation that they may not be breathing properly. So before we rush to the hospital and start getting ourselves examined in the casualty departments, there's a very simple gadget we can all keep it at home called a pulse oximeter. So pulse oximeter tells us our oxygen levels, and we say that 95 to 98% of oxygen levels are very healthy. And as we see the levels dropping below 90 and downwards, that means we need to go to the hospital. So until 93, even you can still manage. Other is to take a 6 minutes brisk walk and then check your oxygen levels. If they are above 95, then we are fine. Or to hold your breath for 30 seconds to 45 seconds. And then if you're able to hold your breath for such a long time, that means you don't have a lung issue. It could just be an anxiety issue. So those who suffer from high levels of anxiety can just take an anti-anxiety tablet. There are so many anti-anxiety tablets in the market. We have clonazepam, diazepam, alprazolam. Just taking a pill can take care of the severe anxiety symptoms, and one can feel better in a matter of a minute or two. And again, that will prevent your visits to the hospital and going into panic mode. I think that is very, very important. And if you are all able to be a bit patient and try to uh, exercise calm, then we can avoid many such visits to the casualty department. Thank you.
Okay, thanks. Are there any questions from the audience? I still don't see. I see JKE with a thumbs up. That's good. Thank you. Any question from the floor? As we wait for that, Dr. Paul, at which point should I now go to see a psychiatrist, in the sense that my anxiety levels have gone too high for me to handle? How does somebody note that?
So, like I had a client who was having several panic attacks in the night, and he would visit hospital, and they would say everything is fine, you're breathing fine, the pulse oximeter levels are okay, your blood pressure is fine, you don't see anything wrong with you. But as they would discharge, you would go home, and in a few hours again another anxiety attack would happen, and again he would rush to the hospital. So after several such visits, the physicians will decide that you need to see a psychiatrist, so they can help you out with your state of mind. So that's when, I mean, when the symptoms are there, but they are not from COVID, but from anxiety, physician makes an informed decision by advising the client to see a psychiatrist. And when they come to us, we again, as I mentioned earlier, help them understand that if their oxygen levels are good, oxygen saturation is fine, then they need not visit the hospital and try to calm themselves by taking some anti-anxiety medications. I'm not advising any therapy here because these are emergent situations. I can ask them to say breathe into a paper bag, or count from 10 backwards, but those things that don't help because COVID is like a near-death experience. So relaxation techniques, etc., they don't help in such emergent situations. But strong anti-anxieties can control the symptoms immediately. Thank you.
Okay, thanks. I now see some hands up. I've seen the one from Bethwell, but there's one from JKE. JKE, if you could just unmute yourself and ask the question, and then Bethwell will follow after that.
Yeah, do you hear me now?
Very well.
Yeah, actually, I just wanted to make a comment much more than I ask a question. I'm very happy, Paul, the way you have presented your paper or your, let's say, whatever the talk you had tonight, and more so addressing the psychological, mental, because I realize many people who are not aware of that, the psychological, when you are weakened, how your body immunity can also become weak.
Exactly.
So that
Exactly.
is what I liked, because I've been telling my colleagues, my friends, not to talk too much about myself, because I also studied psychology at the university. But many people were so broken down and still are broken
Yeah.
down. Therefore, I'm
True.
very happy that you talked about it.
Thank you. You're very right. Whenever we stress too much about a certain condition, a health condition, which is beyond us, which we cannot control, then what it leads to is release of stress hormones in our body. And those stress hormones will further release steroids, natural steroids in our system that will cause calcium to come out of our bones, increase the level of sugar in our blood, making a situation like a diabetes. Okay, the pressure in our blood vessels will be high, making us become hypertensive. So we are already diabetic, hypertensive, and both these conditions lower our immunity and make us more prone to catch COVID than if we are not stressed. Therefore, you may find that many psychologists and psychiatrists advise people not to watch news, not to go on media and read around what's happening in the world uh, this time around with COVID situation, people dying, because that will have a negative impact on us. We should be more watchful of what's happening around us. How can we manage situation in Zambia? Because we are way different from other countries, and their experiences will only make us more stressed than help us in any way. Thank you, madam, for that contribution.
Interesting response there. Bethwell, you had your hand up.
Thank you very much, Tony, and thank you, Doctor, for that presentation. It was quite insightful. I just had a quick question. Immediately, the virus became a pandemic. There was one phenomenon that we noticed. I don't know if it was noticed world over, but in Kenya, we noticed that there was a decline in the number of patients in hospital with normal conditions, where someone would just walk into the hospital, they have a headache. Someone walk into the hospital probably for other ailments other than pandemic. What was the correlation between this? Is it that people feared hospitals because that is where the corona patients were being taken, or is it that people found alternative ways to manage their conditions, if it was pressure, diabetes, malaria, etc., name it? Is it that people found alternative ways? Is it people that feared corona? What was the correlation between these two phenomena?
Well, that's a very interesting observation. The first aspect of that is what you rightly said. People were scared to visit hospitals because they were fearing catching any virus there from the patients who may have been admitted or who may have been visiting hospital for investigations and treatment. So many of the patients diverted from UTH and started accessing private facilities because they were more comfortable going there rather than going to a tertiary hospital, which was the main epicenter for management of COVID. For the same matter, Levi Monamasa Hospital. So there was a fear of visiting such facilities. The second is major hospitals in the country were more focused in managing COVID, and they were diverting the staff and their resources towards running and maintaining COVID units rather than looking at other easy to manage health conditions. So, like for example, our unit of psychiatry at UTH was taking minimal number of patients. Only those who would have any emergency situations would come to us, and rest were asked to not to come to the hospitals, at least until this emergency situation is over. So for a month or two, they shouldn't come. So that's how other situations they declined, and the government could divert the resources towards managing COVID and COVID-like symptoms. Thank you.
Okay, thank you very much, Dr. Paul, for the responses. There's one question that has just come in. Is it a question or a comment? Let me just read it out quickly, and then we can be able to probably respond to it in 2 minutes or so. Then probably give us your final word before we come to the end, because our time is almost up. It is for people who have lost employment or struggling to find employment, what strategies can they use to stay afloat psychologically? That is, they have lost their employment, or they are finding it hard to find employment in this situation. How do they cope with this?
So it's very difficult, first of all, and I empathize with them. You know, I can relate with them of what they're going through, what their families are going through. There is no replacement for that. But we just have to be patient. We just have to wait for this troubled times to pass. As everything else passes, good times go away, so will the bad times. And soon there will be no COVID in the world, and we will be living a happy life as we have lived before. Like the 1918 Spanish flu also had an end to it. That's why we are seeing 2021 now. So likewise, this COVID will also go away. Just be patient. Don't enter into any self-coping mechanisms by drinking alcohol or using other substances. Okay. Try to find employment. Try to see whatever is on offer. As long as it distracts your mind and keeps you busy and helps you with a bit of earning, just go for that. And as these troubled times are over, again, the world will be together and will be prospering, and more companies will come in, more employments will come in, and we'll be back to roaring as we were doing before.
Indeed. So we ought to just hold on a little longer.
Exactly.
There's one last question that has come in. Does the diabetics, or rather, does diabetic, which most of COVID patients suffer from, go away? And if so, after how long? I remember, yes, okay, you could.
Is the question is that most COVID patients, they end up having diabetes?
Yes, that's the question. They're picking up from there, just asking, okay, that which they end up with, does it ever go away? And if so?
So the COVID-induced diabetes is usually caused by the inflammation response of various organs, and that could also be from the pancreas. So as the inflammatory response goes away, the blood sugar levels can come back to normal. The other reason for having high blood sugar levels is the higher doses of steroids that we give to these patients. Some of them, they are getting 1 milligram per kg body weight, so it's around 120 kilos, and they are getting 120 milligram of prednisolone or other steroid. So those high doses of steroids cause hyperglycemia or a diabetes-like situation. As we go along, as the patient improves, we reduce the dose, and eventually we'll stop the steroid, and then the sugar levels can come back to normal.
Indeed, thank you. So there's hope. There's hope along the way.
Definitely.
Yeah, I see questions are streaming in on the chat, but our time is up. Allow us to ask this very last question. I'm hoping it is the last, and then you can be able to give us your final word. There's a question here that says, please ask the doc if he can give a brief comment on the vaccine, COVID-19 vaccine, that is.
Well, I'm a psychiatrist, so it may not be appropriate having come from me. It's better a virologist who can comment on that. So we have one type of vaccine in the country. We are awaiting others to come in. So we are protected from the virus only when 80% of the population is vaccinated. So definitely we look forward to that. And even if a few of us are not vaccinated, then it won't help the cause of eradicating COVID. But definitely, we also hope that better vaccines will be available in the future. Like how we started with polio vaccine, it was an injectable first. We used to give injections, and then slowly it ended up by giving drops of polio, and now polio is eradicated in the world. So we hope the same may happen with COVID as well.
Indeed, thanks. I think my quick one that I'm taking from this discussion is that there is hope. And probably now from your end, what would your final words be to all of us as we come to the end of this session because of our time?
So there were two lady survivors of the 1918 Spanish flu, which took almost 50 million lives at that time. So they said that the only way we could save our lives was to observe protection, social isolation, and distancing. So that's what we need to do. Hand sanitizing, wearing your mask, avoiding gatherings. That's the most important thing. The COVID virus started from Wuhan because they were congregating. 120,000 people were collected in one place and dining together. And that's when it spread. And then it went to the rest of the world. So if you keep on congregating, meeting others, more than 10 people, then we are increasing the viral load. We are getting infected by what virus others have. It is coming to us. So minimize on your group meetings, wear your masks, sanitize your hands, and maintain social distancing. And we are through, we are safe and healthy, and hopefully we'll fight this COVID back. Thank you so much.
Indeed, thank you very much, Dr. Paul. And thank you everybody that managed to join us today. We are still on with this series. Today we are handling specifically our psychology and COVID-19. But from tomorrow, we will have other topics that will be on until the 20th. You're welcome on board and keep inviting others to join us. Allow us to pray as we come to the end. Let us pray. Heavenly Father, we thank you so much for giving us this opportunity and the learning that we've just done. Thank you for Dr. Paul. Continue to use him and continue to be with all of us to keep us safe throughout this situation. And as we've learned, Father, there is hope ahead. May you grant us that hope truly, because we ask this in Jesus' name. Amen.
Amen.